Hi all, my name is Hannah Schroeder. I am a BSN 4 student graduating in May, and I am here today to present my honors project to you all. So I'm a BSN 4 BGSU student. Um, so we have, in order to finish the honors college, you have to do an honors project, and I chose to do mine on vaping. And so I made a nursing care plan on vaping. Um, and had the help of Professor Gibbons. And so today we would love to show you some of the work we've done, and hopefully you can take away some wonderful knowledge that you can know for yourself and share with others. So here, let's go. Let's go get started. So to start off this presentation, I would like to share with you guys my research questions. So when doing research, it's important to come up with research questions so that your information that you're looking up and all the research you're doing has a common focus and that you don't get too far off track. So these were my research questions for the honors project. It is 1, why is vaping an issue nurses need to be aware of? 2, what physical characteristics and social characteristics should the nurse be aware of in a patient who vapes? 3, how can a nurse care for these vaping patients in a hospital, and are there special considerations they need to make for these patients? And 4, what education or counseling is required to help the patient manage these habits? So if you notice there's a common theme with these questions, they center around ADPI. So that's we've all heard of ADPI before from our nursing classes. It's the assessment, diagnosis, planning, intervention, and evaluation. So these are kind of I took them and put them into 4 questions because 5 research questions can be a lot. So throughout this presentation and throughout the care plan, you'll see these questions being answered. So to quickly go over ADPI, just in case you don't remember what it is, or maybe you've never heard of it, um, ADPI is assessment, diagnosis, planning, intervention, and evaluation. And these are the steps to making a nursing care plan. And nurses make care plans throughout every shift, and student nurses make care plans to help them learn how to care for patients. So they're very useful and they're very used in the nursing world. So A stands for assessment. Assessment is the part of the care plan where the subjective and objective symptoms are noted. Diagnosis is when a nursing diagnosis is made, and a nursing diagnosis is different than a medical diagnosis, and it helps direct the plan of care for the patient, and it also gives the care plan a direction. Planning is the next step, and this is the part of the care plan where the goals are made. It is always recommended that the patient and the nurse make the goals together so that the goals can be more achievable. These goals are supposed to be realistic and smart, and they're supposed to have a time frame. They're very thought out and carefully made. The next section is intervention. The interventions are put into place to help achieve the goal that the nurse and the patient make, and these interventions can be interventions the nurse is in charge of and interventions the patient is in charge of. It's a collaboration effort to make sure that the patient can get the best outcome possible. And evaluation is the last section of the care plan where the nurse evaluates whether or not the goals were met, whether or not the interventions were the right interventions for the patient. And this is also a great time for education for the patient because, say, the goals weren't met, this is a great time for the nurse to say, hey, let's try these different interventions, let's make this different plan, and go from there. And it's just to encourage the best health outcome for the patient. And so this care plan was made for those who are vaping and to make the best outcomes for people who are vaping to help them stop vaping. Okie dokie. And after going over what ADPI stands for, it's also important for us to just have a basic understanding of what vaping is. So, vaping is defined by the Webster Dictionary as to inhale vapor through the mouth from a usually battery operated electronic device, such as an electronic cigarette, that heats up and vaporizes a liquid or a solid. So, they come in different shapes and sizes and different types. The most popular electronic cigarette would be the Juul, which is in the bottom right hand corner. They kind of looks like a USB flash drive. They're very discreet, very small, hard to notice, but they do pose a lot of different effects. And pictured is what the vape cartridges look like, the pods. Um, you also have just different forms of vape. Some have the big lithium battery, others may look like a pen. So they can be hard to recognize sometimes, but here are some pictures of what they look like. So to really get this presentation going, it's important to know the timeline that electronic cigarettes have taken in the past few years. So these products were created in 2003 and their use was pretty steady up until recently. So about 2011, there was a survey done, and 1.5% of the youth used electronic cigarettes. So this was a pretty um, okay number. We weren't freaking out, but it was prevalent, which was expected. And then in 2012, 2.4% of young adults used these products. Again, nothing crazy, just your normal population. It was pretty just kind of up and coming. But then when we get into today's age, like 2018, 2019, 2020, well, in 2018, 7.6% of youth reported using electronic cigarettes. And according to the CDC, in 2019, 5 million middle schoolers and high schoolers used electronic cigarettes in the last 30 days. Now, that is just a huge jump from the 1.5% and the 2.4% to 5 million middle schoolers and high schoolers. And this issue really came to the forefront on in the late 2019 area when vaping had started causing hospitalizations, and they were getting news time, and people were like, "Oh God, these products are not great." Well, as of October 8th, 2019, vaping had caused 2,668 cases of lung injury, which is huge. And the injury, could be unknown. Some of them are known, but there's still so many questions that need to be answered. And hopefully, throughout this presentation, I can answer a few questions from the research that I found, but there needs to be a lot more research done on this issue. So I'll share with you some of the research that I found to get a kind of an idea on where the care plan took its focus. So, with the increasing popularity and the public health crisis that we have been entering because the amount of people getting sick from vape, it has brought up very important questions of where's the research? And I was really lucky to have found this article. I really loved this research article because it gave a little bit of an example of what happens when you use electronic cigarettes. And for this one, it's in utero and what happens to babies and offspring as like the effect of using these products while being pregnant. And at one point, we didn't know enough about vape, but they were suggesting to pregnant patients that, hey, instead of smoking the cigarettes, you should try vaping while pregnant, because they didn't know any of the health effects that, but they just knew that they were safer, they were better. So they're like, yeah, do that. And a lot of people did this. And so this can be kind of scary because they're suggesting things to people that we don't have a lot of research on. But in this research study I found, I really loved it because it was done on rats and their pups. It's really hard to find research on humans and babies because of course you don't want to do research on a baby, and most mothers aren't going to allow that. But anyways, in this study, they learned three valuable points of important information about vape. So chronic exposure to e-cigarette aerosols containing nicotine during early development can have deleterious health effects on the exposed offspring. So that's pretty important to know that they did notice health effects, and that the vape that contained nicotine led to reduction of offspring weight and the length of the human embryo, which is also very important because that shows the low birth weight, low birth height. Those are very important issues for a growing, developing baby. And blood flow is decreased in the uterine artery and the fetal umbilical artery after vaping electronic cigarettes with nicotine during pregnancy. And this is also huge because blood flow brings everything to the offspring, the oxygen, the nutrients, and when that is decreased, that would explain why the fetus or why the offspring might have a low birth weight and be small. Um, and so these just brought up very important points. And I really liked this research. What they did is they put the rats inside of this chamber and they tested them with vape that contained nicotine, vape that contained no nicotine, and vape that contained flavoring and nicotine. And they came up with these results. It was very interesting, and it's attached to this PowerPoint at the end if you'd like to look at it. I definitely highly recommend it. It was very interesting. Another resource that I found that I really would love to share with you all that's a little different than the previous research study we talked about. This is research that was collected from a survey. So it was adverse symptoms users attributed to electronic cigarettes results from a national survey of US adults. So this is just a little different because it's not an experiment. Rather, we're hearing what people have to say. And so in this survey, 1,624 electronic cigarette users answered the survey, and these people were 43.9% female, 67.3% white, and the mean age was 37.9 years old. So, just to get some demographics about the individuals who responded to this survey, and of these people, one fourth of them reported electronic cigarette use in the past 30 days. So, this survey is a little bit of a collection of current users and past users. And what they reported was 40% of them reported having a cough as a symptom of electronic cigarettes. 31% reported dry or irritated mouth and of the throat. 27% reported dizziness or lightheadedness. 21% reported headache, and 18% reported shortness of breath. And lastly, 12% reported change in taste. So, very interesting collection of symptoms. And these were very beneficial when I was creating the care plan because the care plan, the assessment portion needed to be filled in. And this gave me some examples and just a broad idea of what these symptoms might be. And as I collected more research, I found that there was a common theme that these symptoms were a lot of the same symptoms that others had experienced. And there are more, and we will examine those in the care plan below. Since I really liked the research that the previous article gave us, I started to make my focus on the research I was collecting a little away from experiments and more towards case reports and case studies and patient examples and surveys. And I still have a few experimental research articles that were incorporated into my care plan. But my favorites were definitely the case reports because the case reports gave us an example and gave us real life scenarios of what happened to real people who used vape. And so this research article is a collection of case reports from all around the world of complications of vaping. And in this case report, it was awesome because it included patient comorbidities, symptoms, the medical diagnosis they received in the hospital, the treatment they received in the hospital, and the health outcomes of these patients. And some of the health outcomes were, well, they went home with home care, or they went home, with no issues. Some of them were death. There were a mix of different health outcomes. And most of the symptoms that were listed on this collection, most of the patients experienced respiratory or GI symptoms. But something that this case study report had that I hadn't seen much else of was it kind of informed us of what happens when you ingest the electronic cigarette fluids, the cartridges, or the pods. And it had a section in this case report of people doing these, and some people did these or drink them as suicide attempts. Well, when the fluids were ingested, or as in swallowed, most people recovered from this, but it caused severe nausea and vomiting and shivering and bradycardia, a lot of terrible symptoms. But one person even injected it into their bloodstream and it caused death. So it's just interesting it's terrible that these products are capable of doing these things, but it's interesting that it presented another hazard of these products, that they can be ingested. This is, could be a risk for children. It could be a risk for those who may be suicidal. it brings up a lot more questions, and definitely this research article provided a lot of information for me when creating the care plan. So it's a great resource, and I hope you guys get something from this one. I really, really loved this one. In this last article, I wanted to share with you guys, it's a little different than the other articles that we've talked about. In this article, it talks about what do nurses need to know. It's just a collection of information that researchers put together based on the research that they could find out there. And so it has a little section about what the CDC has to say, what the American Heart Association, the FDA, etc. It talks about how there is not a lot of research out there, so it's important to not be recommending these products to patients. And then it also has this chart. And this chart was very interesting, and I couldn't find it anything like this anywhere else. And I loved it. So, what it has is it gives examples of chemicals found in various ends products. So, just like a lot of things in life, we don't exactly know all of the ingredients inside of it. And companies are not required to tell you what's all in end products. So it's just very interesting that they did this research and they found these products. I mean, we have um, what formaldehyde, it's used in embalming fluid. Toluene, it's used as an industrial solvent. I mean, you can read, so I'm not gonna bore you because I know that gets super boring as a student. But it's just crazy that there are things. I mean, there's things that are used in car batteries and as a toxic heavy metal, paint stripper. So there's just a lot of products that can be kind of scary that the study found in um, vape products. And this is just another reason that we need more research and more knowledge about these products because these chemicals cannot be good for the body in any way. And so, the part of this presentation and more research um, is to bring awareness to the known bodily effects of these products. So, after going through some of the research articles that were used to create the care plan, here's the care plan. Yay, ta-da, here it is. It took a lot of time and effort, but every piece of this is very specifically chosen. So, we made these nursing diagnoses very specifically because of the assessment data. And we also chose the interventions very specifically to center around what would make sense for somebody who is vaping or using electronic cigarettes in hopes that these interventions would help improve these symptoms. So everything is very thought out, and the evaluation section. So since this is not a actual patient and we weren't able to test out the interventions, the evaluation section is more of a section where we have options for you to give to your patients or to use for yourself or to use for friends or family to give to them to help quit vaping. And so there's a lot of different resources in the evaluation section that will go throughout this description of the care plan. So here's the first section. The first section is cardiac. So the assessment data that we had was tachycardia, blood clots, and fatigue. These were the symptoms that through all the research, we found that vaping causes. And so the nursing diagnoses that we chose for it are risk for impaired tissue perfusion and risk for impaired cardiovascular function. And so with all that, we chose the interventions for if the patient smokes aggressively, we need to console the patient to counsel the patient to stop smoking and refer them to a healthcare provider for medications to support nicotine withdrawal and smoking withdrawal because as vaping is a habit. It's just like the feeling of having something in between your fingers, just things like that. Having something in your hand, it's kind of like your phone. Your phone's an addiction, and when you don't have your phone, sometimes you're like, "Wow, my hand, I feel empty." Kind of feel weird. So we picked everything very specifically, and we'll just go through them really quickly. So here is the second portion of the cardiac section of the care plan. And as you can see, the interventions can be pretty lengthy, but it is good because they offer a lot of information and a lot of different ways for you to implement that intervention. And some of them also offer evidence-based nursing, so they give a reasoning for why and what could happen by implementing that intervention. So in this section, I'd like to quickly just talk about the monitoring the pulse oximetry and administering oxygen for those who need it because supplemental oxygen increases the oxygen availability to the myocardium and it can relieve symptoms of hypoxemia. So it's just important to start off a patient on oxygen, you would, get doctor's orders and start off at 2 liters and see if that helps, because you don't want to put too much oxygen on a patient and say they have COPD, and then you can take their drive to breathe. You can knock their drive to breathe, which would be very dangerous. So it's just important to start low and go slow, and to make sure you have doctor's orders for oxygen. So this is the last section for the cardiac section. As you can see that the chart is pretty long, and it looks a lot better on Prezi, which I will put a link in so you guys can view it as one collective piece, because sometimes that's just a little bit easier for the brain to wrap around. But this last section of the cardiac intervention is to perform a physical assessments for both coronary artery disease and non-coronary findings related to decreased coronary perfusion. So this would include vital signs and pulse ox and equal blood pressure in both arms and heart rate. These are just great interventions to implement for a patient who you fear would have any vascular issues, which vaping can cause vascular issues. Now, this section of the care plan is the respiratory section. So in the respiratory section, this is the one that people think about most, and it's because vaping directly affects the lungs, just like it affects other systems, but the vape is actually going inside of the lungs. And so the symptoms that we researched and found that people had, they had chest pain, shortness of breath, cough, dyspnea, low pulse oximetry reading, and they were often having wheezes. So the nursing diagnoses we chose for this were impaired gas exchange and ineffective airway clearance. Both of those are very important, and they're very life-threatening. So it's important to use these interventions. So you need to be monitoring the respiratory rate and the depth and the ease of respiration. And if you notice that they're using their accessory muscles, then you know that something terribly wrong is happening and that you need to do something about it, because like if the respiratory rate exceeds 30 breaths a minute, this could mean significant cardiovascular or respiratory alterations that are there. It's also important to monitor oxygen saturation continuously, because say the patient has fluid in their lungs, this fluid might move. They might be able to cough some out. They might be getting Lasix to get the fluid off of them. But it changes. People are changing all the time. So it's just important to keep a close eye on that to avoid any terrible events. And this is a continuation of the respiratory care plan. I'll just let you read through this section really quickly. And this is the final end of the respiratory section. The intervention I'd like to point out in here is to help the patient deep breathe and perform controlled coughing, because having the client inhale deeply and hold the breath for several seconds or cough 2 or 3 times while their mouth is open while tightening the upper abdominal muscles. Controlled coughing uses these muscles, and it can help make the cough more effective, so they can actually get the gunk that might have settled into their lungs out of their lungs. It's kind of like a pneumonia patient. It's the same thing, because vaping really, really affects the lungs and the little alveoli cells. So it's just important to be able to help them get airway clearance. The next section is infection. So something we noticed with vaping users is they had elevated white blood cell counts. They often had fevers coming into the ER. They would experience chills, and they would have inflammation, systemic or local inflammation. So the risk of infection is a nursing diagnosis, and ineffective thermoregulation is also an important nursing diagnosis, and we have these different evaluations for that. So we just need to keep track of lab values and such to keep an eye on what's going on. And this is a continuation of the respiratory section. You can go ahead and look through these interventions. I'll give you a second to read them. And the evaluations are always the same. They're very important and helpful for you to know and for your patients to know. So go ahead and read this section. And the rest of this is the continuation of the infection section. One last thing I'd like to point out about the infection section is if you read through the interventions, it says to go over the use of antibiotics. So, one important thing to know is that throughout the research, uh, I found out that when a lot of people were going into ERs because of vape related illnesses, they were being put on antibiotics in the ER because a lot of doctors thought that they just had pneumonia. So they'd give them antibiotics, send them home, and then the patient would come back saying that they still felt ill and they still did not feel well. And so it took some trial and error to kind of figure out where these vaping illnesses were coming in and who was being diagnosed with a vaping related illness. So this could just indicate that a lot of people may have been missed from the proper diagnosis, but it's good to know now that sometimes if you look at the lab values or continue doing assessments, the proper diagnosis can be made. On to the next section, and one of my favorite sections is the skin section because it is a section that people do not often associate with vaping. Burns. Burns are a huge issue with vaping products because electronic cigarettes are made of batteries. And sometimes these batteries can be faulty, sometimes they can just spark. There's a lot of different terrible things that can happen, and they've caused burns. They've caused a lot of wounds on patients, second-degree burns. So the nursing diagnoses we gave for skin was impaired skin integrity and risk for imbalanced fluid volume, and that would be resulting because of burns. So I'll just give you a second to go ahead and read the interventions. And here is the continuation of the skin portion of the care plan. I'll just give you a few seconds to read through some of this. And this is the final section of the skin section of the care plan. And the intervention I'd like to highlight on is recognize that an individual fluid management plan must be developed incorporating client-specific assessment parameters. And this is very important to highlight because through this study that I found with all the burns that patients were experiencing because of the electronic cigarettes exploding, they could be in different spots of the body. Some were on the hand, and some were on the buttocks because they were in a back pocket. Some were on the thigh or the groin because they were in a front pocket. And so the surface areas may be very different. And when you're giving fluid back to a burn patient, you don't want to fluid overload them, but you also don't want them to be hypovolemic. So just very important to know the parameters of fluid management. And the last section of this care plan is the gastrointestinal section. So the symptoms that we found that patients with vape-related illnesses experience included nausea, vomiting, diarrhea, change in taste, sore throat, and weight loss. And the nursing diagnoses we chose for this were dysfunctional gastrointestinal motility and deficient fluid volume. So we'll go ahead and go through those on the next slide. So this is the final section of the GI portion of the care plan. One intervention that I'd like to point out is to monitor daily lab values because it is very important since if a patient is having a lot of diarrhea or a lot of vomiting, they are losing a lot of fluid, and so this could make them dehydrated, but it can also cause them to have electrolyte imbalances, and electrolyte imbalances can cause a lot of different things with the heart, with the lungs. So it's very important to keep track of. Or they could also become a greater fall risk because they could have hypovolemia, and when they stand up, they could have orthostatic hypotension, and we don't want patients to fall. It's like one of the worst things to happen. So it's just important to keep a good eye. And since this is the last section, I would like to talk again about the evaluation section. The evaluation section has a lot of great resources for you to know, for you to have for your patients, for your friends, for your family. There's text lines, there's call lines, there are different links for you to make even a quitting plan, and just resources for you to have that give you more reasons to maybe quit vaping. And the Truth Initiative is an awesome resource I really enjoyed everything they had to offer, and so I recommend that you take a look at that. So here are the final words of the GI section. Of course, there are just a few things that didn't fit, but um, I'd like to highlight that in the comments of this YouTube video, I will put the link to the Prezi if you'd like to view this care plan in a more uniformed way. I'm hoping that you learned a lot. Thank you so much for listening. I really appreciate you all. If you have any questions, you can direct them either to Professor Gibbons or myself. I put my email on there. And in my resources section, there are a lot of different articles and a lot of different research that you could find. And if you want to hear of any more of the research I collected, go ahead and email me and I can send you all my references. Thank you so much for listening to me today, and I hope you all have a wonderful day and a wonderful end of your semester. Good luck on finals.